Hello, I am Michelle Panino, Director of Member Services at YWCA Greenwich. On behalf of the YWCA, I am happy you have joined us for another event designed to empower women and create valuable learning opportunities for our YWCA members and the community. While this event is free, we are grateful for your support of YWCA mission and programs. I am very pleased to present to you part one of When Staying Home Alone is No Longer Safe or Practical. Today we are focusing on three topics. When is it smart to get help for seniors living alone? What kind of resources exist to allow someone to stay home safely? And what options exist for seniors in terms of senior communities with support? 2 weeks from now, on March 10th, we will continue this conversation with expert panelists focusing on part two, the dollars and cents of long-term care. We will cover long-term insurance, Medicaid planning, and how to optimize your medical insurance coverage. We have assembled a panel of community experts to lead today's discussion. They are here to share their insights, their resources, and to answer your questions. We ask that you type your questions into the Q&A, and the panelists will answer as many questions as time allows. Any unanswered questions will be responded to after the session through a written response that will be distributed to all attendees along with a recording of this session. Lori Contadino has graciously supplied a link to many of the town's resources, which will also be distributed. And now I would like to introduce Mimi Santry, who will serve as our moderator. Mimi Santry is a longtime Greenwich resident and is the managing partner of Assisted Living Locators of Western Connecticut. As a certified senior advisor, she consults with families on how best to care for aging loved ones, whether it be through enhanced home care or a move to a senior community. Her services are free to her clients. Mimi had a long career in finance prior to retiring to raise her 5 children. She now works full-time and serves on the board of Parsonage Cottage, the Friends of the Greenwich Senior Center, and is a class officer for Princeton University. Mimi will now introduce our other panelists.
Thanks, Michelle, and Kathy Seiden in the background. And hello, everyone. We're so lucky to have really the senior dream team with us today. We have Lori Contadino, Donna Spellman, and Lori Pensiero. Lori Contadino, as most of you know, is director of the Greenwich Commission on Aging, a position that she's had since 2013. She has a Master's of Science in Gerontology, a certificate in Thanatology, I had to look that one up, and has worked in the field of geriatrics for 37 years. Lori goes nonstop. She helps seniors navigate their health insurance enrollments. She informs the public about really important issues such as how to get their vaccines, impending storms. She spearheads the efforts to keep our seniors safe and engaged through the Greenwich Senior Center. And she's also helping guide Greenwich to become an age and dementia-friendly town. In her free time, she's on more boards, and she resides in Old Greenwich with her family. Switching to welcome Lori. I'm going to call her Lori C because we have a Lori P as well. So welcome, Lori. Second, we have Donna Spellman. Donna is Executive Director of River House Adult Day Center. It's a non-profit medical model adult day center, which has been serving our community since 1977. You might know it's situated right on the Mianus River. It's quite stunning. Donna has a master's in community counseling from University of Bridgeport and a graduate certificate in geriatric social work from Boston University. She's been working in human services for over 30 years. Donna is an amazing runner, and she currently resides in Norwalk with her husband and her 3 college-age kids. Finally, Lori P, Lori Pensiero. She wears many, many hats, and I'm so happy she's on the panel because she can speak from her experience both in home care as business development manager for Osborne Home Care, but she's also a licensed EMT with Darien EMS. She is one of the most active volunteers in the senior community that I know. She's involved at Stanford Hospital, where she trains people in dementia. She is also a volunteer for the Stanford and Greenwich Senior Centers. And she's also famous for delivering treats to all her friends and colleagues, celebrating National Hot Dog Day and all sorts of other important days. So the first question today, I'm going to ask Lori P. As an EMT, if she can put on her EMT hat and talk a little bit about the topic of prevention versus reaction for families. When is it smart for families to reach out for help? What do you see a lot of, and what would you tell these families about what they should be doing?
Thank you, Mimi, for having me today. As an EMT, biggest thing we see is falls. That's what we basically are we get called for. Calls. Prevention, I always say plan ahead, have a plan. You may not need it right now, but all of us have probably aging parents or loved ones. Start doing your research. You don't want to make these decisions in a crisis. When I speak about home care quickly, I will say no one home care fits everybody. There's different hats and different companies and different styles. So you want to do your research on that. You want to know what to ask. You want to take the time and write down all your questions so you don't forget them. As an EMT, the biggest thing is falls. Like I said, it's sometimes going through and evaluating your loved ones' homes, you know, as they get older. Where are the dangers? Do they have the handrails in the bathroom? Are you taking up the little mats in the kitchen that so many older people like to use? These little rugs all over the place that become fall hazards. Is their house the house they should be aging in? Now that might not mean going to an assisted living, but maybe downsizing their home to something more manageable, maybe a condo or something one level if they're in an older house with lots of stairs or lots of things to navigate. So there's a lot to think about, and it might be something you do a little at a time, but have different plans for different situations that may arise.
And the typical obstacles at home might be the width of doorways, grab bars, steep driveways, rugs, you know.
Stairs to the basement where the laundry may be. In some of the older homes, your laundry used to be in the basement. Entryways just to get into the home. How many stairs are there to get into the house, you know?
And the message is really to take these steps before the senior falls, because falls can be quite serious. Lori C., can you talk a little bit about if somebody's witnessing their elderly loved one taking numerous falls, you know, it happens a couple times, what's the next thing they should do? Who should they reach out to? How do they get help?
Absolutely. So thank you for that question and for hosting this incredible conversation today. So we know that falls and complications from falls are a major concern among older adults. And after you've taken that first fall, you are at increased risk of falling again. We know that it's the #1 cause of serious injury, hospitalization, long-term care placement, and even death among older adults. So with anything that's medically oriented, you would start with your primary care doctor first. That's the first place that you should go. But as Lori and you, Mimi, pointed out earlier, there's a great deal that individuals can do to take that proactive step, to take a really intense look at the home that the individual is living in. And I like to look at, you know, what is the precipitating nature of why the person is falling, right? And in my mind, there's 3 buckets of reasons, right? Is it a health-based reason that there's something medical going on? Is it an environmental risk? And the things that you both alluded to, really assessing that home environment and seeing, you know, are there cords and wires that are tripping hazards? Is the path of travel free and clear? Are pathways and stairwells illuminated? Is the home the right home for that person in this stage of their life to maximize their independence and their level of functioning? And also, what are the triggers? You know, are there things like someone went out to walk a dog and the dog pulled too hard and the person went down, a wet floor or an icy stair, those sort of things. We know that it could be that it's time to look for additional help in the home. It could be a home care agency that's contacted. It could be a more supportive environment like the one that River House provides. It could be a variety of things. And our approach, regardless of who you contact within the senior provider professional network, is not a cookie cutter approach. It really is tailored to the needs and desires and particular situation of the caller and who is seeking the assistance of, in my case, the Commission on Aging.
Okay, thanks, Lori. Switching to Donna, you know, I would say falls is probably the number one concern for the elderly in their home, but the one that I hear a lot about is, especially during this time of COVID, is sort of witnessing an elderly person slipping cognitively. And it seems like it happens rather quickly. And you know, it causes a lot of concerns, elopement, leaving ranges on, med management, people taking their pill over and over and over again in the same day. So Donna, I know that River House actually offers both assessment and a lot of services to people with dementia. Could you talk a little bit about River House and what a family should do when they see this kind of slippage?
Sure. Like everybody, thank you so much for having me. I'm thrilled to be here. You know, like everybody else has said, loss of memory and confusion is not a normal part of aging. I think people need to understand that first and foremost. Everybody who ages does not get dementia or develop dementia. Some people do. And I think it's really important for people to ask the question, is the forgetfulness, is the confusion sudden, or has this been coming on over a period of time? Like it's already been said, the first stop should always be to your doctor, because there are a lot of medical issues that could cause confusion and a loss of memory. And so that is always the first stop. And we tell that to everybody all the time. But then after you've seen a doctor, when things, you know, have been assessed, yes, we can further assess here at River House. So what is River House? River House is an adult daycare center, and who we support here are people who need assistance during the day, but could otherwise live in the comfort of their own home. They are people who maybe need additional help at home when they're not here, but don't need a level of care that a nursing home, let's say, or an assisted living, let's say, might also provide them. They are people who have the ability to remain in the comfort of their own homes. What do we do here? We are what's referred to as a medical model adult daycare center. So we are health-based. We have full-time nurses and health aides and certified nurses assistants who provide hands-on nursing care, health assessment, medication management, and so on. But the true reason why most people come here, if you ask the client who's here, it's to have a great day. So people come here to have to exercise and enjoy the time with their friends and be stimulated, and those are things that actually help people improve their cognition in many ways, because we all know that when we're stimulated and we're happy, we feel better and we function better. But back to your original question, what do you do first? First, get checked out by your medical provider, always first.
And Donna, are there, you know, I know there are places within Greenwich that will do a cognitive assessment. I know there's Greenwich Hospital. Do you have people that can do a mini mental?
Yes, our nurses can do a mini mental.
Okay,
yep.
All right. So that's really helpful. Sort of on a similar topic, and this goes back to Donna, one of the issues I hear a lot about is families having the best intentions, just wanting to take care of their family member at home, but underestimating how much energy it takes, how much coordinating it takes, and there's a real toll on the family. And there's great guilt about that, feeling like I'm raising my own kids, I'm taking care of my parent, they're failing, it's just not working. Can you talk a little bit about caregiver burnout and
Yes.
what resources are available for family members, not the elderly person, but actually the family?
Right. Caring for a loved one is a two-person equation. It's the loved one that you're caring for, and as Mimi just said, it's the person who's the caregiver, the family members, and in most cases, it's the entire family, because it does take its toll on the entire family, not just the primary caregiver. So I cannot recommend enough self-care and a constant searching in terms of, what do I need as the caregiver to make sure that I'm well and that I'm taking care of myself and that I'm okay with this? And I can't stress enough the need for additional care at home, because just because you're there doesn't mean that you alone can care for your loved one as their needs increase. So if your desire is to keep your loved one at home, if you're so able, certainly, adult daycare, that works for many. It's not right for everybody. None of this is a one size fits all. You have to look at your own family makeup. But there are caregiver support groups. I cannot recommend enough the Center for Healthy Aging at Greenwich Hospital as one place. The Alzheimer's Association has caregiver support groups all over the place. And right now it's even more convenient for people because we're Zooming. So it's become actually much easier for people to attend. But self-care is number one, because if we don't care for ourselves, we're really of no help to the people around us.
And statistically, there are terrible statistics that oftentimes the caregiver, the primary caregiver, predeceases the elderly person because of all the stress. So a lot of times you'll see couples and they're trying to do the right thing, but they're actually not achieving what, the caregiver is getting very ill as a result. Staying on this topic a little bit, Lori C., can we talk a little bit about a hot topic during COVID, which is isolation? Seniors have historically struggled with isolation, but COVID, staying safe has made it even more challenging. How do you balance keeping seniors safe with the other risk of being isolated, depressed, and understimulated? What are things that families can do for their aging loved one?
So this pandemic has taught us many things, perhaps most notably that we're all social creatures by nature, that we need regular human contact. We need to engage in activities and pursuits that are meaningful to each of us, and that differs across the spectrum as each of us are unique individuals. The Commission on Aging and Greenwich Senior Center launched a full platform of programs the past year. One called Connect is basically the virtual senior center. It is a collaboration with Greenwich Country Day School, daily programs ranging from exercise classes, Zumba, Pilates, to Italian classes and art classes. It's free of charge, and all you have to do is click on the link to join. Because it's a Zoom-based platform, there's always that option of connecting via telephone. So you may not be able to see your friends, neighbors, and others, but you can hear what's going on. We recognize also that the pandemic has brought to light the great digital divide that exists among older adults. And older adults for us, age 60 through later years. And we have active members that are over 100 years old that are digitally connected and more active on Facebook than I am. So if there's any way to get your loved one technology to assist in the basic use, to download the Zoom app, so that they can participate not only in town-sponsored programs, but during this year, you know, Broadway, New York Broadway stars have a variety of things available to everyone. Depending upon what your needs and interests are, you can go to the Metropolitan Museum of Art for a tour. You can go to an opera. You can go on a travel log, you know, and so much exists by using the internet. We also created a program called $2.99 to You, which was originally designed for the low-tech, no-tech users, kind of a senior center by mail. And every quarter we mail out an engaging, and it's meant to be cognitively stimulating and engaging, and to introduce something new so that folks have something to talk about. I find that at home too. You know, my life has gotten very small and there's less to talk about. So these are things that you can work on independently. You can work on, you know, on the phone with someone. And so always, you know, something good to do. But what's important is, you know, to call your friends, to sign up for our Bridging the Generations program, where we have volunteers, both adults and high school students, that are willing to call and give weekly calls to check in and chat. And we actually have some students and some adult volunteers that have called older adults in our community every week for the past year. And now they're great friends. And one day, perhaps they'll meet. But there are so many opportunities for engagement. Engagement keeps our mood up. It keeps us mentally stimulated and challenged. And it's really the best medicine for warding off isolation, depression, and you know, the loneliness that this time that we're living in can bring.
Thanks so much, Lori. The other thing I'll brag on you is that you've had some fun, like, drive-throughs at the Greenwich Senior Center. And I know, Lori, you've done that in the Stanford, Lori P.,
Yes.
the Stanford Senior Center, so that it's safe, but they're getting their treat, you know, getting a Halloween treat, driving through, seeing people,
Yeah.
waving.
Yeah.
So it's really up to the family member to get in touch with the Greenwich Senior Center, get the programming, and make sure that the senior is prompted so that they know what's going on and they can engage.
Yes, absolutely. And we're moving our meals now to weekly drive-throughs as more and more individuals become vaccinated and the nicer weather, like today, is somewhat on the horizon. And you bring up a very valid point. This has been the only time that we have had in the past year actually to visually see the older adults that we used to be in the midst of every single day. And so it benefits us as much as it benefits them. Just drive through and say hi, and you know, we're always up to something, you know, to try to make people laugh and feel good. So
Thanks so much. I'm in and out of the senior community so much, and I get a lot of phone calls from families where the senior doesn't really need physical care, but they want to consider a senior community because they're just sitting at home alone with no stimulation. And so it takes away some of the burdens of cooking, cleaning, provisioning, etc. But most of all, it gives these seniors other people to hang out with, have meals with, do activities with. So there's been a real increase in inquiries to me for that reason. Speaking about communities and being in groups, Donna Spellman, can you speak a little bit about, is it safe for seniors to attend something like an adult day center? And I can speak a little bit about what they're doing in communities in terms of safety precautions and making sure that, you know, people are testing, et cetera. So Donna, can you talk about, is River House safe? Are other senior centers safe?
I can speak to River House.
Yep, thank you.
River House has been open since July, has reopened since July, since the beginning of July. And I can tell you that we work very hard to be COVID safe. Our staff is tested weekly. All of our participants who have returned were tested before they came back. And we have all made an agreement. This is the most important part. I'll tell you all the things we're doing to follow the CDC guidelines, but we all made an agreement. We all, meaning the staff and the families, that our lives were going to be very simple and very careful. And so our lives would basically be river house and home, and river house and home. And we would really reduce any risk that was not necessary. So there are things that we ordinarily do when we're not in the midst of a pandemic that we're not doing right now, and we miss very much, but we're not going to do those things. You know, we don't have visitors in the building. We're not utilizing multi-passenger transportation. We're not doing a lot of things that could open the risk of, you know, of just being in contact with too many people. What we are doing is that we're socially distancing here. So we don't have 50 people here, but instead we have about 20, 22, 24 at the max, so that we're all 6 feet apart from each other. We're all walking around wearing our masks all day, every day, and shields on top of those masks for many. But other than that, we're vibrant. We're together. We're here every single day, and we're doing everything that we can to live our lives with COVID, understanding that we have to be careful, but we're vibrant and we're safe. And the reason that we're safe is because we've had such incredible commitment from everybody involved. And I will tell you that there are 41 adult daycare centers across the state of Connecticut. Not all are medical models like we are, but most are. And about 70% have reopened over the past year, much like us. We, at this point, our entire staff has been vaccinated, and about 85% of our clients have been fully vaccinated. The rest are on their way. So, you know, slow steps, but careful. And even post-vaccination, we will continue to do everything we're doing now until Dr. Fauci says we don't have to.
Great. I'm going to chime in and say, in the senior community, so I'm in assisted living, memory care, skilled nursing communities quite a bit. You know, things have changed dramatically since a year ago. They've got their protocols in place. They're testing regularly, both the residents and the staff, and most of the residents have had their 2 vaccines. That hasn't changed really much in terms of people are still masked, they're still not gathering in large groups, but you can just feel this sense of comfort that they're not as at risk anymore. And so things I would say, if people are considering communities, they're open, they're admitting, they're safe, and and you can tour. They're allowing tours. Some of the higher acuity communities will not allow tours. You'll have to sit in a separate area just for some memory cares, but most of the others you can actually tour. Okay, so the next question is one about, what do things cost? Budget is a really important consideration for most families. Can all of us from our basically add what we know about what things cost? So let's start with Donna. Could you tell us what would a family pay if they were going to bring somebody to River House? And then Lori, if you could talk a little bit, Lori P, a little bit about home care, and then I'll go through what assisted living memory care costs.
Sure. So the full fee, and we don't charge extra for different things. It's, you know, it's one fee that covers everything that we do, with or without COVID. The full fee is $100 a day. And in the best of circumstances, that includes transportation as well. However, what I want to say about that is that we have a very generous sliding scale. We also accept long-term care, and a good number of our participants are here on Medicaid waiver programs. In short, we will never turn away anybody due to a lack of ability to pay. We will find a way. We will scholarship, we will find a way. So
That's
know,
awesome. Thank
if
you.
you're right, then come see us.
Okay, Lori Pensiero, could you talk a little bit about what does a home care agency charge? And you can talk about hourly and daily rates, et cetera. And can you also speak to why somebody would use an agency versus somebody, off of Craigslist?
Well, with home care, there's a wide range of pricing. So not wide, but it's the gap is slowing. But you're looking anywhere from $28 to $33 an hour for hourly care, and most companies usually want a 4-hour minimum, 3 to 4 hour minimum per time they're used. There's also what we call a live-in, which is when someone lives in your home. You're looking at anywhere from $350 to $430 a day for a home care live-in. And the price can go up depending on your care, how much care is needed, if someone has to be awake at night or can they sleep at night. Everything is tailored or should be tailored to the person. So most home care companies, I would say, will tailor to your care and give you a price based on what you need. But it can be quite expensive, can get up in 90s and 100,000s depending on your care per year. So that's another consideration when you're thinking about home care or assisted living or any of those things.
So Lori, if somebody's looking at the number and you said, 27 to 32, and they're like, well, I could hire some kid for $15. Why, what does an agency do for you?
Okay. I get this question a lot, and I tell them an agency gives you a very protected environment. So yes, you can hire a private caregiver cheaper than you could with an agency, and you can get a very good caregiver. I'm not going to say that. But when you're thinking about the liability part, we'll just go there first. If someone's coming into your home to care for someone that may have issues, whether they're fall risk or dementia, where they at times may get a little violent or a little agitated, there is a possibility of someone getting hurt. And with an agency, you have the coverage of the liability insurance, workman's comp, a company behind them that they're staff. So you're not financially responsible for that person if they get hurt in your home. They're covered by the company, the agency you have hired. That being said, make sure you've hired an agency and not a registry. There is a difference between a home care agency and a home care registry. A registry is, we'll say for lack of a better word, is like a staffing agency. They're finding you caregivers, they're giving them out to you, referring them to you, but those caregivers are independent contractors. So you will also be responsible for their 1099s, their tax withdrawals, making sure you have workman's comp, liability insurance that will be your responsibility as the person hiring them. Where with an agency, you don't have those same things. So I tell people be very careful because caregivers do get hurt on the job. It's part of the job. Whether they hurt their back or get bitten or get hit or just slip and fall when they're out maybe shoveling your sidewalk because they're there to help you and accidents can happen. You want that liability insurance. You don't want that to fall on the person that needs the care.
And the other thing is if a caregiver doesn't show up.
Right. With an agency, we're going to make sure they're there. If they call in sick or if they're out or they need a vacation, you have a whole agency behind you that's going to make sure you're supported and you're protected through that time. Whether we have to get a caregiver over there within 5 minutes or an hour, we can do it. Or if someone needs to take a vacation, you have backup. When you hire a private caregiver, if they don't come that day, they don't come that day, and then you're without care. And some people are okay with missing care for a day or so. Maybe, they're fine. But there's people that absolutely need someone with them every day, all day, and that could be a risk. Right. So having the company behind you is a big comfort to you or a family. Plus, most home care companies have a 24-hour hotline. So if there is an emergency or a problem in the middle of the night, there's someone there. There's nurses they can call. The caregiver can call and talk to their on-call nurse. They can ask questions. They have the support too. So not only does the family have the support, the caregiver has support from their company to help them in an emergency too.
Yeah, that's great. And that nursing oversight, to have most agencies that are really good have, multiple nurses or a lead nurse who is overseeing the case and also doing the training of the staff, which I think is really invaluable. So thank you for that. I'm going to go back. We were talking about pricing. So Donna mentioned pricing of adult day. You mentioned what home care costs are averaging. And I was just going to share the way that assisted living, independent, so communities are basically grouped into categories. So you have independent living. And the way to think about that is it's a condo on steroids. You've got the senior moves in, their meals are taken care of, their activities are taken care of, the driving's taken care of, the utilities are included. And typically independent communities will have full kitchens, washer dryers. Those, that all-inclusive price in this area probably starts at $4,000 a month, depending on the size of the apartment. Assisted living is very similar to that, except care is included or added on. And typically in assisted living, there's kitchenettes and not washer dryers because the laundry is being done. And those assisted livings in this area are probably starting at around $4,500 and up. Oftentimes people gasp when they hear those prices, but if you will do a financial analysis and you include in the cost of real estate, the cost of utilities, the cost of food and other provisions, cost of car, etc., the communities can oftentimes be economically very advantageous. For me, when I'm talking to a client, I don't care if they're going to have home care or go into a community. I just want to help. What you see is when there's a tipping point when somebody needs more than sort of 6 to 8 hours of help, where financially they benefit by going into a community because the concept is shared care. Instead of hiring someone for 4 hours, you get a very efficient delivery of a caregiver that's caring for other people. So the pricing actually can come down. But families should just know that when you work with an advisor, have them price it out for you. See which one is less expensive. And don't just make the assumption that going into a community is going to be pricier. It depends on the circumstances. Moving on, transportation is a big issue for seniors. People start losing their ability to drive safely. They get rid of the car and then they're stuck at home. Lori Contadino, could you talk a little bit about the Share the Fare program and other resources within Greenwich to help seniors who are sort of housebound?
Absolutely. So the town of Greenwich has a program called Share the Fare, which is a subsidized taxi voucher program where the Commission on Aging has an agreement with Greenwich Taxi. So residents age 62 and older can purchase taxi vouchers from the Commission on Aging office. A $20 book of vouchers is sold for $10. So it's half price discount at the point of sale. The resident then arranges for their transportation with the taxi, and whatever the meter says is what the older adult would pay in vouchers, because again, they've already received their discount. At the end of the month, Greenwich Taxi then invoices the Commission on Aging. They reduce the bill by 10%, and the other 40% of all rides, all vouchers redeemed is paid for through the Commission on Aging's budget, and that's the subsidized program. We have a limit of $100 worth of vouchers per month, and it's actually $200 worth of vouchers because they're paying $100. And for that amount of money, truly what it provides is the independence, the autonomy, the ability for an older adult to still make decisions about where they want to go, when they want to go, whether it's weekends, during the day, after hours transportation, and so on and so forth. Again, because we're in this pandemic mode, Greenwich was very rich in terms of transportation resources. We had our beloved Call a Ride, which I hope that, if not in 2021, we will definitely see a return in the late fall or in early next year. TAG provides services, but the commission is not providing any congregate group transportation because of the risk of transmission. Through agencies, if you happen to be a member of At Home in Greenwich or some of the other groups, and I think River House even goes out on a limb for some of their folks too. If a ride is needed, volunteers are found, and those volunteers are vetted, or with Donna Stellman, I'm certain it's a member of her team or someone that's a trusted source, and so on and so forth. But there are options out there, and I do believe that we need to have an optimistic view of the world at this point, and that things will slowly be adding, coming back, and we'll be able to add some of these things back into our lives, which should help everyone. Mobility is really important, but no one has been going anywhere the past year, so.
And Lori, while I've got you, cars and grocery shopping often go hand in hand. And I know
Yes.
a lot of times people will witness that their groceries are spoiling, they're not able to bring things in, or they can't manage. Can you talk about grocery delivery services?
Yes, there are a lot of meal delivery programs that you can sign up for. And if you can register with Meals on Wheels, you could get home delivered meals or drive through meals through us, home delivered meals through Mom's Meals and Top Chef and all these other online options. You can order through the Fresh Pantry or the Peapod or the Costco, the Instacart kind of app. But again, with that digital divide, does the older adult not only have the technology, the ability to, navigate and have access to the internet? Because what we also found in some of the more congregate communities during the pandemic, that they had internet access, but only in community rooms. And so individuals in their own private, rooms or residences didn't have the access that they would have had if they could be in a shared space. But there are many different services. And I do believe that there are new opportunities now for entrepreneurism, within all of these arenas that we're going to see pop up to meet new and emerging needs and different ways of how we'll all live our lives as we move forward and past perhaps the worst that we've been through.
Okay. Lori, can you, I know we're running short on time. We talked about how all these issues could take up a solid hour. I would just have you speak a little bit about your resource, the Greenwich Commission's resource book, as a catch-all, a place for people to go. Can you talk just quickly about that?
Yes, so very quickly, the Commission on Aging is a resource for the community, for the region. Contact the Commission on Aging, and if we can assist, we're happy to assist. Our services are free of charge, and we don't have anything to sell except an unbiased view and access to information, which is free. So the resource guide that we published that Mimi will provide a link, and there will be an update to this in the future, runs the full gamut of, what does aging in place mean? Who are the aging in life care professionals? What is home care? What's the difference between skilled and or medical or non-medical care, and just a little bit of everything. So oftentimes it's the first place to look when you have a concern. And if you want to have a deeper dive conversation with me, you would then follow up and contact me Generally, I provide options in all the areas to narrow down an individual's focus because the book can be overwhelming. And if you just give me a cold call and you have a story to tell, sometimes it's what's most helpful is understanding, where do we begin, in all of this. There might be multiple steps to take, but we all have to begin somewhere. And what's the most important place to start?
Okay, thank you, Lori. The next question, and I asked Michelle to put the slide up, is if someone's starting to think about moving from their own home, sorry, can we go? Yeah. When families are starting to explore senior communities, how should they start? And so I put the slide up because the most important thing a family can do is really do a self-assessment. Because they're going to drive the process. What are their goals? What are their needs? So the questions that they have to ask themselves is, what kind of care is required? Do we need memory care? Do we have a medical requirement where we need skilled care? Or is it more we just want socialization? That's going to inform you as to what kind of senior living you're going to look at. Location, that's obvious. I will make a comment that we live in a very expensive area. And so if people are trying to economize, you're not going to win that battle in Fairfield County and Westchester. But most families want to be near their loved ones. So that's just a consideration. Budget is a big driver. Amenities, I have a lot of clients that are swimmers. They have to have the swimming pool. Another question is, can my loved one stay in this community till end of life? That's an important consideration. Is that important to you? Size of community, culture of community, timing. And the last one is a new one. The last criteria is, when you're thinking about communities, do you need to visit? Do you need to visit regularly? Because some communities have restrictions on visitation, others are more relaxed. And a lot of times that depends on the community's experience and also what their focus is. So anyway, so once a family understands what they're looking for, they should sit down with an advisor who can then help them come up with a really good short list of communities they should visit. They should ask questions, and they should look at the other residents and see, would mom and dad fit here? Would they be happy here? That's my recommendation. So going on to the next question, how are we on time? We've got 8 minutes. Okay. Lori Pensero, when people look to hire someone, what are good questions that you should ask a caregiver? And what kind of training should an aide have?
Okay. So first, if you're going to an agency, you want to be able to tell them, know what their training is. What's their continuing training? What certifications do their caregivers already hold? So are they a CNA, which is a certified nurse assistant, an HHA, home health aide? Are they just a companion? Do they have any kind of certifications or training in dementia or whatever it may be that your loved one or yourself are going to need? First, you want to know how that's matching up. In Connecticut, the laws are so different of what's allowed, and pretty much there's a big gamut in the home care of different training and not training. So you have to ask those questions. What is your company offering? What do they do for their caregivers? How do they support them? I think is a big thing. Do they provide continuing education? If a client has special needs, is there someone there to train them in those special needs to make sure they understand those personal needs of that client? If you're just looking for the engagement or a companion, what does this person do? What do they offer? Do they speak more than one language? Is there a language barrier? Are you looking for someone that can converse with them in their language? There's so many things. And like I said earlier, there's not one company that fits one client. So that's the questions you want to ask. You want to make sure they have what you need, because what Mary might need might be different from what Sam needs, so because your neighbors had a great experience or something with a company, that's a great place to start and to maybe interview, but that might not be the right company for your loved one or yourself, you know.
And I know that Lori C's resource guide actually has a section in it which lists good questions to ask when you're interviewing. So that would be another place for people to look.
And another important thing, Mimi, which I did mention, was also with agents, you want to ask, do they do background checks? Have they done background checks? You know, it's a big important thing. Who do they use for their background checks? What kind of background checks? Is it just a background? Is it a DMV? Is it fingerprinting? I mean, you're putting someone into your home. You want to make sure they're as safe as possible.
Okay. Thank you so much. Lori C., can we talk a little bit about health insurance? That is Medicare enrollment, and the choice of plans is so confusing for most people. How do families get some help with that?
So we have a health insurance counseling team. I am one of 5 insurance counselors. We're certified and trained through the state of Connecticut Choices program, and it's over 30 hours of instruction, and we actually have to sit. I thought the days of taking exams were over, but we have to sit for a certification exam every 3 years. So our counselors are well-versed in original Medicare, Medigap supplemental plans, Medicare Advantage plans, the Medicare D prescription drug plans, and other options that exist for older adults. We will see individuals that are currently enrolled in Medicare, individuals that are new to be turning 65 and want to plan for, you know, what are their options? Should they stay on perhaps a spouse's employer plan or go off on, you know, traditional Medicare? What are the costs associated? And it's also very important to understand that one of our goals is to empower people to understand the coverage that they have, what their options are, so that they're always well-informed consumers. And we cannot guide into any of the plans that are available. It's always the client's decision, but it's important to understand what your coverage is, and to know that just because, as Lori mentioned about home care agencies, just because your neighbors, you know, are on the Anthem plan for their prescription drug coverage does not mean that that's the best plan for you and your individual medication profile. So all you have to do is to contact the Commission on Aging. My staff will set you up with one of the counselors. And again, it might be myself or one member of my team. And we'll do our very best to help you with whatever your questions are or securing the coverage that you need.
Okay, thanks, Lori. I'm going to, I am looking at the clock. It's 1:57. Michelle Panino has told us that we can go over if we want. So should we open it up right now to questions? And thank you to the panel for all this great information. Does anybody have questions that they'd like to share in the chat section, or are we all set? I think we've looks. I'm assuming, Michelle, you can.
Yeah, I don't see any questions coming in yet. One came in while you were speaking, just asking about the recording, and I just let them know that we were going to be sending out a recording in the next few days, so everyone's aware of that. They'll be able to repeat this, but I don't see anything else.
Okay,
I
wondered if, I'm sorry, Mimi, I wondered if Donna Spellman might want to talk a little bit about our caregiver circle. That might be of interest to this group.
Right.
Sure. Caregiver Circle is an informational program that is that we typically do 4 sessions twice a year actually the YWCA, we had set to do it and then COVID happened. But the YWCA has been gracious enough to allow us to do the caregiver circle, or had been gracious enough to allow us to do it at the YW. We had been doing it at Greenwich Library prior to then. And we bring in, similar to this, we bring in professionals to answer your questions and to present topics that are of interest and relevance to people who are the non-professional caregivers, to family and friends who have loved ones who they are either anticipating becoming a caregiver or currently a caregiver. And we welcome your suggestions of topics that could be helpful. The way to address that is to get in touch with either me or with Lori Contadino. We want to provide programs that are relevant and that are helpful to you. They're always free of charge. They're usually in the evenings, though we have done them during the day as well. And who knows, with Zoom, maybe we can offer them at various times. And you know, we're happy to be of assistance to our community.
Thank you, Donna. So thanks to the panel. Thank you, Michelle, for organizing this. And I would just reach out to the audience if you have further questions or you want to dig a little deeper. Anybody on the panel would be, you know, we'd all be very happy to have, you know, more in-depth conversations after this concludes.
So Mimi, with that being said, I will be sending out the recording and the resources in the next few days. So all the registrants and participants will have my email. So if anyone would like to reach out to me, I can forward your questions on to any one of the panelists and they can get in touch with you directly. In the meanwhile, I'd just like to say take this opportunity to say thank you to Mimi, who all of your efforts for pulling this presentation together on behalf of the YWCA, and to Donna, Lori C, and Lori P for taking the time to share all of this very important information. There is quite a bit for us to think about. In the next couple of days, I mentioned, I will be sending this recording as well as a list of some resources to our participants. Please keep in mind, March 10th, we will be holding the second part of this series. So I certainly hope that you will join us again. Have a great day.
Thanks, everyone.
Thank
Bye,
you.
everybody.
Bye.
Bye-bye.
Bye. Have a good day. Bye.
Bye.